Good morning. This morning, by filing a lawsuit in federal court, Lexington took the next step in our war on opioids. This lawsuit is designed to hold 20 wholesale drug distributors and manufacturers accountable for dumping opioids on our city. It is the right thing to do. It's only right that the drug distributors and manufacturers pay for the serious problems that they are causing. For several years, with the help of partners across our community, we have been fighting back, hand in hand, against the deadly opioid crisis. Yes, it's been declared a national health emergency. More than 63,000 deaths in 2016 in the U.S., thousands more than the 37,000 who died on our nation's roads last year. You can see many of these partners here today, our council members, who have helped and expanded funding for the many steps we have taken to fight opioids. Angela Evans is here, James Brown, Kathy Ploman, Richard Maloney. Attorney Peter Mujay, his firm Levin Antonio, is out of Florida, and they are handling the suit. They are the lead counsel among a coalition of attorneys in the case. Members of the faith-based community are helping us fight back, and they are here with us this morning as well. Pastor Bill Ellis and Pastor David Howard from Emmanuel Baptist. Apostle Thomas Clark from the House of God here today joining us. From the Health Department, which runs the Needle Exchange Program, Dr. Craig Humbaugh. Our Commissioner of Social Services, Chris Ford, and our Commissioner of Public Safety, Ronnie Baston. These two commissioners have worked closely together in an unprecedented way on this issue. And also, from Public Safety, of course, our Police Chief Barnard, Fire Chief Chilton, and Director of Community Corrections, Steve Haney. Also from Social Services, Amy Baker, the Director of our Substance Abuse and Violence Intervention Office. Amy's doing some commendable work, providing an online comprehensive resource guide for treatment alternatives and helping people find the treatment they need. Lisa Menten from Chrysalis House, representing one of several social service agencies that the city helps fund and provide treatment. Tonya Meeks, who lost a child to opioids, and Debbie, who is in recovery. As you can tell, we have a lot of partners across the community who are working hard, vigorously. They've come up with many innovative approaches. Even so, overdose deaths doubled in Lexington between 2013 and 2016. And Fayette County ranks second in the state for heroin-related deaths and second in the state for fentanyl-related deaths. Opioid abuse is taking a serious toll on our city and our citizens through loss of life, financial hardship, and increased criminal activity. These next steps are appropriate. This lawsuit, we are joining 34 counties across Kentucky in suing drug distributors and manufacturers. Well, first today, we're going to hear from Councilmember Richard Maloney, who has been a leader on this issue. Richard?
Thank you, Mayor.
Yes, sir.
Thank you, Mayor. I just really want to get into the personal part. Everyone here knows or had somebody that has dealt with this opiate drug problem and had died. And I made a promise to one lady who I watched her daughter grow up and had 2 kids, and she died 3 years ago. And she said, find out whatever you can about this drug and how my daughter keeps getting it and all that, and how it's so simple. So not only did I make a promise that I'll do that, I also found out a lot of things with this drug use. It is hurting the community, plus this government. We had in the last 2 months, we've had 2 employees, kids died from overdose. But the thing that it also does, it drains our budget. And as you know, the police and fire and the jail is overpopulated for what this is, and it is drowning our budget problems, and everybody knows that I have a problem with, when it comes to spending money, we gotta find a way to get it back. And not only is it hurting here, it's hurting the state of Kentucky. And one example that was given to me a few years ago, there were 5 cities and counties in the United States this were the top drug in the country. Number one was Los Angeles, over 4 million people. Number two, number three, and number 4 and 5 are here in Kentucky in these small counties. One county has a population of 65,000. So when you see those kind of drugs coming in Kentucky, they're going somewhere because not everybody can take those drugs. So what has happened, they're coming into Lexington, and that's how you get these drugs so easy. So I've been trying to find out a way to stop this. Well, lucky, thanks for the lawyers that I met with and the county people calling me and telling me about the lawsuit and all that. We were able to learn 2 things that I was able. First of all, I want to know what opioid did. First of all, that drug was a good drug at one time. It helped patients with cancer that are dying. For some reason, the pharmacies went and told doctors that this is even a good drug for everything, from broken bones to plastic surgery and all that. That's where the addiction started coming. And when I talked to the lawyers, I said, what those 5 counties that I was talking about, who's responsible? Is that the doctors? He said, no, it's the pharmacy. And he gave me one example, and I think everybody needs to understand, everybody knows what cars are. You have a Ford dealership, and you have a Chevrolet dealership, and you have a Chrysler dealership. Each one of those have a person, a middle person, that deals with the dealership. So, for instance, in Lexington, we're supposed to have so many Ford cars come to Lexington. The middle person keeps track of all that. And if they don't, and the dealership doesn't do what it's supposed to, they ban this. So take that same thing with the drugs. They have a middle person, but they've not been compliant. They have not followed the compliance procedure with the drug. And this is what caused Eastern Kentucky to get all these drugs. And this, to me, is a big problem, and I'm glad that these guys are on board. And one question that everybody asks, and I want to make sure everybody understands, why we're not tapping on with the state. The state is going after, the Attorney General is going after the fines. What we're going after, the reimbursement for our police, our fire, our social service, which is the best in the country. And they're drowning right now, and they will be glad to tell you that they're drowning, and Chris will probably talk a little bit about how bad it is. So I want everybody to know what we're going after is the reimbursement of those costs. The state is only going after the fines. So hopefully I want everybody to get that clear, what we're doing. So I'm really excited about that, and I think it's going to be a good thing, and I appreciate everybody, and I appreciate my colleagues, the council, and the administration for doing this, and I do thank you for all y'all's work. Thank you.
Thanks, Councilmember Maloney. And I want to recognize Reverend Keith Tyler, who's just shown up. Thank you so much for joining us, Reverend Tyler. Next, I'm going to ask Public Safety Commissioner Ronnie Baston to share some thoughts. Ronnie's been helping people find their way out of addiction for many years. It's something that he's very passionate about, as are so many who work with Commissioner Baston in public safety. Ronnie. Yes, sir.
As Mayor Gray made very clear in his opening remarks, the opioid epidemic is a community problem. Addiction is striking people young and old, in all neighborhoods, and across all socioeconomic levels. And it's going to take all of the community to combat this. Thankfully, over the last several years, under the leadership of Mayor Gray, the Public Safety Department and the city as a whole has been able to make strides in combating the scourge of opioids. As Public Safety Commissioner, I'm proud to say that our public safety agencies have added services and expanded our capabilities when it comes to responding to the opioid crisis. Our team is very committed, and they're making a difference. For instance, the Lexington Police Department has detectives who are specifically assigned to drug overdose cases. They interview witnesses and survivors in order to build cases against drug dealers. The DARE program has been reinstated in our schools to make sure kids learn the danger of drugs before they ever get the chance to try them. Police officers are assigned Narcan kits to help save lives in the case of an opioid overdose. So far this year, police officers have administered 90 doses of Narcan before the arrival of EMS. And let's not forget about our partners at Fayette County Corrections. They've played a very important role in battling the opioid epidemic by creating a substance abuse treatment program inside of the jail. The facility hosts a 20-bed inpatient treatment center for those in the jail population who are addicted to drugs. For those who meet the criteria, Corrections also offers medically assisted treatment, which helps those leaving the jail prevent relapse. Community Corrections also provides funding to the Hope Center to deliver substance abuse recovery programming to men and women who are incarcerated. In addition to those who are attending treatment programs are also provided with life skills training. These programs give inmates a path to sobriety while serving their sentences. It's one of the few programs of its type in the state. And the fire department, who we all know are our frontline lifesavers in Lexington. Just about every day, our EMS crews are called to multiple opioid overdoses. Our fire department sees firsthand just how devastating and deadly these drugs are to our community. At the same time, the department has saved countless lives through its Narcan program. About 6,000 doses of Narcan have been administered since 2012 in Lexington. Just last year, 1,550 doses of this life-saving drug were administered. In late 2016, the City of Lexington began partnering with local churches to educate pastors and community members about the opioid epidemic and what everyday folks can do to help make a positive impact. This partnership between the Department of Public Safety, Social Services, Fire Department, and the Lexington Fayette County Health Department has been hosted at churches around the city. We have trained community members and pastors about opioid addiction, treatment and recovery resources, how to use Narcan, and the city's needle exchange program. I'm grateful that a few of our local church partners are standing here with us in solidarity today, and they've already been introduced. Thank you all for being here and what you do every day. As I said at the beginning of my remarks, to be successful, it's going to take significant involvement of the entire community. I'm optimistic about the future based on the collaborative efforts that we've seen displayed so far, but we have more room at the table, and we encourage others to get involved. It's only together that we can prevent deaths and keep dirty needles off the streets. It's only together that we can prevent our kids from trying drugs in the first place and help those caught in the grips of addiction to recover. I'm so proud to live in and serve a city which is willing to take on this challenge. And I want to again thank Mayor Jim Gray for his leadership on this issue.
Thanks, Ronnie. Thanks. Thanks so much, Commissioner. And next, we wanted you to hear from someone who works with addiction every day, and that's Lisa Menten from Chrysalis House. Lisa, will you tell us more about your work at Chrysalis House? Thank you.
Thank you, Mayor. Chrysalis House has been saving lives for almost 40 years. We are Kentucky's oldest and largest licensed substance abuse treatment program for women. The chrysalis is the protected stage just before the beautiful butterfly emerges, and that is what we want for the 200 women and children we work with each year. We specialize in pregnant and parenting women, allowing babies to accompany their mothers to treatment. Last year, 59 infants resided with their mothers in our residential treatment, with an additional 32 children joining their mothers in our apartments. We could not do what we do without the support of the community. The Lexington Fayette Urban County government's extended social resource grants helps the mothers and babies at our Chrysalis Court location. The $119,600 per year for the next 2 years adds stability to the provision of services for this most vulnerable population. Our holistic approach empowers women to live substance-free, obtain employment, find safe, decent, affordable housing, and become tax-paying citizens. One client states, "Chrysalis House gave me the knowledge, educating me with facts not just about addiction, but also about motherhood and employment for a woman in recovery. I felt empowered, and for the first time in my life, I wanted something better. I wanted something different. I wanted to stay clean." And so that's what we're all about at Chrysalis House. And I also want to mention that our board president, Lindy Carnes, is here with us today, as well as Jennifer and Connie on our staff. So thank you.
Thanks, Lisa. There's some brave women with us today and who have experienced this crisis firsthand. I'm going to ask first Tonya Meeks to share some thoughts with us. She lost a child to opioid addiction. Tanya, thank you. Thank you so much.
Thank you, Mayor. My name is Tanya. December 3rd, 2014, I got the worst call that a parent could ever get. My son had died from a heroin overdose. At the time, he was my only child. He was 19 years old and a freshman in college. It was so devastating to me and, my family. His heroin addiction and his death caught us all by surprise. We really didn't know that he had started using heroin. But there's this old saying that says, "Hell has no fury like a mother scorned," and I'm definitely scorned. I have been in the community since trying to change the statistics in our community. And I'm so grateful that we have just the great support system in our government and our social services to help battle this addiction and the epidemic that's taking communities nationwide. And thank you guys for supporting them and our police officers and places like the Chrysalis House who do amazing, amazing work. Thank you guys for listening to me, and let's support this lawsuit. Thank you guys.
Thank you, Tanya. Thanks for your inspiration. And next, we're going to hear from Debbie, who is herself in recovery. And I said earlier that these are brave women to join us today, and Debbie, you're very brave to join us. Thank you.
Well, I definitely want to start out by saying thank you to everybody that's battling this. It's an epidemic. Nobody wants to be an addict. Most people don't want to die. Most people want to be a good mother, good father, good daughter, son, be successful at life. But it happens, and we're seeing that it's happening to people from all walks of life, people that never thought it could happen to them. I'm grateful for all you guys. I went through the Hope Center in 2010, and it saved my life. Very structured environment. They targeted all areas to try to help because you can't just do one and not the other. And as a result of that, I was able to live life on life's terms and have a job and be a mother and a friend. And then sometimes people lose their way, and that happened to me in October last year, and I called Hope Center and they got me back in. They didn't even have a bed. They put me a mattress on the floor because they knew I needed a safe place to stay, and I'm grateful. I don't know, guys. It's sad because people are they're dying every day. And these are people's family members. I hope nobody, I know it's discouraging, but I hope everybody stays vigilant in places like Chrysalis House and Hope Center and many other places. I'm just grateful, and thanks for letting me share today.
I want to again thank all of you for being with us today. Before I ask for questions, I'll say, I don't think anybody likes lawsuits. It's like Debbie said. Nobody who's an addict wants to be an addict. But holding those accountable, we know, is essential. And that's what this is about.